So there's this huge puzzle in American healthcare. You see, we spend way more money on it than any other country in the world. But are we actually the healthiest? The answer, well, it might surprise you. So let's dig in.
Okay, let's start with a number, $11,172. In 2018, that's how much was spent on healthcare for every single man, woman, and child in the US. That's a lot of money, right? But a number like that doesn't mean much by itself. To really get a handle on it, you've got to compare it to something.
And this is where it gets, well, kind of shocking. Back in 2017, the US was spending over 10 grand per person. Now look at other developed countries. Germany was under 6,000. The UK, barely over 4,000. We're not just spending a little more here, we are playing a whole different ball.
And this, right here, is the paradox at the heart of it all. For all that cash we're spending, Americans, on average, actually live shorter lives. Take a look at Australia. They spend about half of what we do per person, and yet their citizens live about 4 years longer. So you've got to ask, what's going on here? This isn't just about money, it's about value. And the big question is, how do we fix it?
So where do we even start to fix this? Well, the folks on the front lines are healthcare professionals and researchers. Think of them as architects trying to design a better system. And just like any good architect, they can't just wing it. They need solid blueprints, and those blueprints have to be built on hard evidence.
And let's be really clear about what's at stake here. This isn't about spreadsheets and budgets. It's about people. This quote is from a patient who, after a major health event, felt they had lost their entire sense of who they were. Getting healthcare right means we're not just saving lives, we're saving identities.
All right, so that first blueprint, it's all about solid evidence. Good intentions are great, but they're not enough. Every decision, every new protocol has to be based on rigorous research. But it's not as simple as it sounds, because research is just full of these hidden traps we call biases that can totally twist the results and send us down the wrong path.
Let's take a classic one, selection bias. Imagine you're running a study to see if online classes are better than in-person ones. If you let students pick which group they want to be in, well, you've just blown up your whole study. All the super motivated students might choose the online class, making it look way more effective than it really is. The only way to avoid that trap is to assign people randomly. And another huge one is gender bias. Basically, it's when a study is way too focused on one gender, so you can't really apply the findings to everybody else. And this is a really big deal in nursing research, where for a long time, studies almost exclusively looked at female participants.
Wow, and this chart just says it all, doesn't it? A review of hundreds of nursing studies found that almost 3/4 of all participants were female. So you have to ask yourself, how can we be sure a treatment works for men if they only made up about 1/4 of the people it was tested on? Getting good evidence means your studies have to look like the real world.
Okay, so blueprint number 1 is all about having solid, unbiased evidence. Got it. But, a brilliant new treatment that nobody can afford isn't really a solution, is it? And that brings us to the second blueprint, asking the all-important question of value.
And that brings us to this incredibly simple but super powerful equation that's driving so much of healthcare reform today. Value equals quality divided by cost. The goal isn't just to provide the highest quality care anymore. It's about getting the best possible health outcomes for the lowest sustainable cost. That's the secret sauce. That's how you create real value.
So if you're a healthcare leader with a new idea, how do you prove it's actually worth it? How do you convince the people holding the purse strings? Well, they use a business tool you've probably heard of, return on investment, or ROI. It's a way to measure if the financial wins from a new program are bigger than what you spent to get it started. And calculating ROI isn't some kind of dark art. It's actually a pretty straightforward process. First, you got to define exactly what the project is and how long it's going to take. Then, and this is super important, you need something to compare it to, like how things were running before you made the change. And finally, you have to track every single penny, what you invested upfront and all the financial returns you got back.
Okay, so ROI gives you that big picture yes or no. But if you really want to dig into the value of a project, there are a few other more nuanced economic tools analysts use. Each one helps you answer a slightly different but really important question.
This table lays out 3 of the big ones. First up, cost-benefit analysis, or CBA. It's the most direct. It's all about the dollars and cents. Do the financial benefits add up to more than the costs? Simple. Then you have cost effectiveness analysis, or CEA. This one's more about people. It asks how much did it cost us to give someone an extra year of life. Finally, cost utility analysis, or CUA, takes it one step further. It's not just about a longer life, but a better one. asking how much it costs for a year of good, healthy living. Each tool gives you a different piece of the puzzle. All right, so let's put it all together. We have our two big blueprints. 1, base everything on solid, unbiased evidence. 2, focus relentlessly on financial value and sustainability. And when you merge those two powerful ideas, what you get is a total redesign of how we do healthcare.
And this slide right here really captures the revolution that's happening as we speak. We're leaving behind the old way, what we call fee-for-service, where we basically paid for how much stuff got done. More tests, more procedures, more money. We're moving to this new model, value-based care, where we pay for how well it was done. Did the patient actually get better? That's what matters now.
And the North Star for this new model is something called the triple aim. The goals are simple, but they're huge. Goal number 1, make the experience better for the individual patient. 2, improve the health of the whole community, not just the people who are already sick. And 3, the big one, do all of that while bringing down the cost for everyone. That's the new architecture.
So here's the bottom line. The blueprints, they're not a mystery. They exist. We have the tools and the designs to build a healthcare system that's more effective, more efficient, and more human. The challenge isn't figuring out what to do anymore. The real question is, how do we get everyone to pick up the tools and start building it a whole lot faster?